Welcome back, bump lovers, to another exciting, positive, authentic, focus-driven episode. We acknowledge that the Bump Love community's input is what makes this show. We read, we catalog all your messages, and we believe that there's no message too small or mundane for the show. So a while back, we had an episode on cosmetic surgery, and our DMs were awash with questions. And in true Bump Love culture, we decided we are not going to leave our people's questions hanging. On the show today, we have an expert who will be able to answer some or all of your questions. Ladies, please join me in welcoming a Christian, a husband, a father, and a certified reconstructive and cosmetic surgeon, Dr. Peter BIRIBWA Kansiime.
Thank you. Thank you for having me on the show.
Welcome to the show.
Excited to be with this bevy of fine ladies. Bump Love, Wordsmiths too. Yeah.
We're happy you're here to save us from the questions.
Right? So maybe we could just break the ice by, ladies, could we speak about our fears with regards to cosmetic surgery?
I was thinking about this question, and when I think about doctors and surgeons, I think about them the same way accountants do their jobs, painters, tailors, and they make mistakes, right? Yeah, they make mistakes. You know, you send your dress to the tailor, she ruins it, and then you have to either find another dress. But now when a surgeon makes a mistake, and you have to live with that mistake, and if it's on your face, maybe even explain to people, so you see, I went to this surgeon, and oh my gosh, yeah, he didn't quite know what he was doing. So I view surgeons and doctors as human beings who are prone to making mistakes, except that the mistakes that they make are grave and they impact your life greatly. So that's one of my biggest fears about doing surgery. I'm like, what if that's the day that he makes the mistake? Maybe he was tired, or he has been stressed out, he's been in a very long surgery, and then you're the next patient, and maybe he had to fly back to Mombasa. But doctor here doesn't make mistakes. I think for me that's really my biggest fear, about doing surgery.
And now it's elective.
It's elective, yes. So
you entered with wanting something, you've come out
exactly, like what I ordered versus what I got. You know, and so that's one of my biggest fears. The other is regret. I fear having to deal with regret, especially knowing that then there's nothing I can do about it. If there is, then I have to go back to the same doctor and say, now pay more money and say, is there a way you can rectify this? It can never go back to the way it was. So for me, those are my two biggest fears about doing this kind of surgery. You want to comment?
May I interject? So regret is I think part of the things that we deal with daily.
Oh, okay.
And in a good way, you know. You wish you kept time. You wish you did this. So in real life, we're always dealing with that. But when it comes to surgery, we look at it like a flight. Before the plane takes off, everything is checked. You plan for yes. So except I think perhaps are more intense than pilots, because for this finite set of time, you want to do your very best.
For sure.
So part of the ways of mitigating the outcomes is to choose right. Make sure that the surgeon operating on you has done it before. Is certified, do your due diligence. And then also, you said to error is human. But even when there is, say, a complication, the surgeon you choose should be able to address that complication. If you have a surgeon who cannot address a possible complication, then perhaps you need to choose again.
It shows wrong. Oh, okay. So, interesting.
I think my fear is because I've not been under the knife for anything, because most people have I've not had surgery before. I've not done a C-section before. So you're thinking, okay, so I'm going under the knife for tummy tuck, and you're just like, okay. I wish, because I'm thinking, if I've done C-section, it's easy for me, yeah, because I've done this before, I've healed. So for me, it's like a first time to eat. And the fears are new, like they would be new. Oh my God, how long will this heal? How fast does my skin heal? So I don't have that history, and that would be my fear. But also pretty much like what you said, like, you know how I come and tell you I want my nose looking like this? This hair, people do this to us all the time. You tell them I want my hair looking like this, and after you look at yourself in the mirror, you're like, no, I said I wanted this angle. So I'm thinking I'll bring my nose, my butt. I'm like, no, I wanted it in this shape. I think you didn't get it right. Yeah. So those are a bit of my fears when it comes to that.
I wouldn't call mine fears, but no. I have no fears. I'm living proof that cosmetic surgery is everything.
But you said in the Muna show that you wouldn't do it again, and you mentioned reasons why.
Yes,
so
beyond. Okay, that's how I'll say. My concern would be, no matter how educated you are, you can never really understand the healing process.
Yeah.
But once it's done, then you're happy.
And you've healed.
Once you've, it's a process, you know. Nobody really tells you what a C-section will feel like, or how, you know, when it rains and you feel itchy and whatever. But with this, after that is done, to be honest, I wouldn't do it again. I don't know if I would, but no fears. No fears.
I remember my concern going in. So I've always had a really low tolerance for pain. I've always had, but it's something that I started to work on after I gave birth. I hate needles. The two things I've said on this show before I fear in my life are praying mantis and needles. I fear needles so much, but it is something that I have over time been able to work on. Like I have like a whole mind over matter mentality, and that thing that you've said, that it will get done. So like every time I'm going somewhere or doing something and I'm going to face something difficult, I keep psyching myself. Pumla, Olaba, even you're now how old? 38. That 8 years have passed. So this moment is also going to pass, you know? So I literally, I keep psyching myself, but it does not remove the fact that I still have some kind of, sitting anxiety in my stomach when it's going to happen. So my fears have always been pain. I remember even when I was going into the labor ward, I took my gyna aside and I told her, if I end up having a C-section, me and you, we're done. I literally told her and said, but Pumla, you cannot control this. I said, if I see anyone bringing papers around, but sign here, we are done. Mostly because surgeries take more time to heal. That means you're in hospital longer. That means that they are in drip. That thing entering my vein, you guys, it's one of the biggest fears I have. And now we are going on drip. So for me, my problem had always been pain, and then I worried so much about the healing process. Because of course, if you're having a longer healing process, now maybe that's more needles. I was like, now what are we doing? And then I like to be in control. I like to be, I'm hands-on as a person. But now when you're healing, someone has to look after you. I don't like that. That whole thing of being looked after, that's why I'm falling sick. I hardly fall sick, and I think because my body is like, this girl, if she falls sick, now that's a bigger problem.
Let's keep ourselves
let's keep ourselves, and healing. I remember a doctor told me, oh, by the way, Dr. Kansiime was my doctor, my surgeon. He's the one who did the boob. And I remember he told me, so I kept on asking, most of my questions were about healing. Me, the surgeon, I've decided to put myself under the knife. Now it's not in my control. Actually, I never asked him anything about what are they going to do. I didn't care. What I wanted to do was, now that I've woken up, what are the things that are going to help me manage this healing better? The first thing he told me, smoking and drinking will make your process harder. I stopped boozing that day. I stopped, and he said you have to stop before if you because if you have alcohol to prepare your body. I just stopped him. Anything he told me that would make my healing easier, I implemented, because that was the part I kind of feared.
I'm curious to know how long this healing process normally takes. I know there's no but how long?
Different surgery, different healing process.
And mine was a little longer than he had told me, because like he said, there had been a little complication that he was able to manage, but that management needed a little bit of time. I had taken leave over the exact time he had told me I needed to heal, which was 2 weeks. I needed more, but I had to go into office.
Okay.
Yeah.
So it just took about 4 weeks?
I would say for me to be able to be like really okay, I would say like 4 weeks. Okay. Mine was 4 weeks. And then he also learned, and you see, by the way, it's a learning process. We learned together that I have sensitive skin, you know. So our bodies are different. You can learn things that day. Like he realized that I had sensitive skin, which had caused that extra, you know. So he had to come back in and do something small, but that was now fixing something. Not that a mistake had been made, no. It's that my body had reacted to something, but he was able to manage that. But that management needed, I think, a bit 7 days, 10 days.
That's a bit comforting. I thought it was like 1 or 2 months.
No. And even the 4 weeks, I'm saying like full, because me, I don't want to be put down. I'm very active. But he had told me, take care. You listen to your body. Don't push it. But I was back to office in under 2 weeks.
And made sure no one. Yes, go ahead.
So maybe speaking.
With my books, like,
yes, no one was bumping into you. Help me.
So speaking into and about that, most healing, if you have breast surgery, the skin will typically heal in 5 to 7 days, usually. But on the inside, the healing continues.
Just like the other normal surgeries.
So about the second week or so, it should more or less be sticky enough to be stable. By the third week, you can actually lie on your breasts, and they wouldn't be problematic at all. If you have a BBL, you can actually comfortably sit around the third week.
BBL? You know some of these things we have
Brazilian butt.
Brazilian butt,
Or in this case, butt lift, Yeah, so if you had, for example, you know, the Brazilian buttock, for example, is more curvy. It's more sport-like, you know, like the athletes we see. But the Ugandan butt is more pyramid, or so to speak, narrow waist, wide at the base. So those are the differences. But you find sometimes you have to, say, add fat. And for that fat to survive, you need time off
for it
your butt. The same thing applies to, say, the breast. So there is that normal healing process that needs to be sort of followed through. And if you do listen to your doctor, you do get faster, better results. So the doctor and the patient,
are working together.
Which
is where I guess you need to choose well.
And then it's also important to make sure that pain is well controlled. So an important element to the surgery is the post-op care, and it determines a lot about how fast you heal, how well you heal, and the outcomes. So it all gels together to give you the final
product. All right. So fun fact, my husband was actually MC at doctor's wedding. So when he walked in here, I was like, wait, I know him. Yes. And I think I've heard this story, the question I'm going to ask you, but I guess for the benefit of our viewers, why did you decide to go into plastic surgery?
Plastics. It's really God at work. That's the only way I can put it. Because going through, even as a child, grew up in Ruvaga Hospital. Mom was an anesthetist at Ruvaga, so we spent a lot of time around hospitals. And the role models I had at that time were of course, Mom, and the doctors. And I wanted to be a surgeon even that early. So that one I knew. So getting into high school, it was PCB I wanted to do. And I did that. But in O-level, I also discovered I liked drawing. I'd always liked drawing. So fine art was part of it. So for A-levels, I ended up doing PCB art.
Art.
Very strange.
Interesting combination.
Very strange. Yeah. So I think that year I was the only one doing art, PCB art. Yeah. Going through med school now, I knew surgery. Second option would be OBS because I wanted to operate. And then fast forward, I spent a lot of time with plastic surgeons. Initially, I thought it was just clefts and was trying to run towards heart surgery, you know, big surgeon, big operations. And then I discovered there is a lot in plastic surgery. The turning point for me was when we fashioned a breast for a lady who had had breast cancer and had had a breast mastectomy or an amputation of the same. And it was interesting having her perform a tummy tuck for her and fashion a breast for her. So she got a tummy tuck and she got a new breast. For me, that was a turning point.
Yeah, turning point for you.
And so I 360 turn, heart surgery to breast surgery and plastic surgery.
People are dying because there is no heart surgery. We have one less heart surgery.
Yes, you could say. But so plastic surgery didn't suddenly seem vain, you know. It wasn't just about clefts or say just nose jobs. I could do a lot more. You know, add a smile to someone's you know, outlook and impact lives. Because as a doctor, you get into it to make a difference.
For sure.
Yeah. So.
Wow.
So plastic surgery is the way God is using me to make a difference.
Was that the first one that you did? The one that made you do that 360 turn, was that the first one?
No.
I'm curious to know, like, the first time you did it, were you excited?
Yeah, so I had always been amazed by how much artistry was involved in cleft surgery. So we did cleft surgery all through my undergraduate as well. I was working with the plastic surgeon, Professor Kahinga, renowned plastic surgeon in Kenya. And then we went on, and as I got exposed to the field, I was like, wait a minute, there is a lot here. And so then, you know, things add up, you know, the whole, the exposure, and so it was a worthwhile. What I find interesting is that as a Ugandan, I was the first surgeon to be trained in plastic surgery at the University of Nairobi.
Yes.
So so you have so you have a Ugandan surgeon coming through the training in Kenya and graduates first. I mean, it's not my own doing, but really, if I say God had a big hand in this,
He really did.
You can see. So it was one thing after another, and here we are.
I love that. I love that cleft surgery is one of those surgeries where, like you said, you're putting a smile on someone's face, and it's amazing to see that you've impacted, you've changed someone's life. So, but my question to you would be, for this woman who, you know, wants to change, she wants to do a tummy tuck, but she knows that in the near future, she wants to have children. So would it be safe for her to do surgery? Like, will she be able to breastfeed after she has had children? Actually, a friend of mine was curious to know if this works.
Yeah. So the outcomes that we get are usually dependent on the technique used, the surgeon's skill set, and also the severity of the condition. The larger the breast, in fact, some big breasts cannot produce milk. They are big, but they do not produce milk per se. So if you're coming from that setting whereby there is not enough milk in the first place, it's unlikely that even after the surgery there will be milk. So it depends on where you're starting. Yeah, but it is possible to, because when you look at breast surgery, for example, we are looking at, are we able to preserve the sensation? The answer is yes, it's possible.
Lol.
Yeah, because the breast is a beautiful organ. It's a reproductive organ too. Yeah, so it is important that sensation is preserved. There are things that may be lost or gained. There is a 30% chance that someone may lose sensation or be unable to breastfeed. So it really is dependent on the surgery, the technique used. Yeah.
Okay.
And then, but the results are
And the tummy?
the tummy. So the tummy, usually we say if you've given birth, you would want to wait at least 6 to 8 months before you have a tummy tuck, because you have lots of fluid on board. Baby fat too, you lose a bit of that. And then when you are, say, ready, then you can have the surgery.
Another surgery, but then can you get pregnant?
Yes.
Are you able to?
Yes. Yeah.
What I would think actually is that would you advise somebody who is going to go back
To have
children, to then do a surgery?
Wouldn't you just say that
Wait.
finish, and then I come and work on you?
Sounds like the logical thing to do, but sometimes it's not quite the case, because people have surgeries for different reasons.
Yes.
Sometimes you may find that there's a hernia involved.
Oh, yes.
Sometimes you may find, and it could be painful. Every time you work out, it hurts.
Okay.
And I've had such patients, they have a piece of tissue sitting, say, in the umbilicus, and every time they work out, it hurts. So they choose to, say, have the hernia surgery along with the tummy tuck. So situations vary. But ideally, it would be good to have a tummy tuck way after you're done. Then
I really like what you've said. So to the ladies out there who would like to get a tummy tuck and you don't want people to know about it, but in line with Rosette's question, could you speak into the people who would generally not be good candidates for this kind of surgery?
I usually ask my patients to try and have active lifestyles, walk, exercise, be fit, because once you've built up that physiologic reserve, then recovery is much faster. Yeah, so, and then things like vitamin C, some zinc supplements, they also aid, because they are cofactors in healing. Now, persons who are no touch for plastic surgery, a person, say, who have what we call comorbidities, or conditions that preclude surgery.
Yeah.
For example, if, say, someone has end-stage renal disease, is on dialysis, patient is on dialysis, there's no way we are going to perform tummy tucks, because that catapults them to heaven. Yeah, so
Catapult them.
yeah, so
Oh gosh.
so that but you get what I'm saying.
Yes.
So if someone is very sick, usually you would want their treatment to continue, as opposed to, say, going for a cosmetic surgery. So if someone has bilateral hip replacements, unless if it's absolutely necessary, you don't want to subject them to a tummy tuck. If someone has, say, very advanced, say, cancer of the liver, you get the drift. You don't want to subject them to cosmetic surgery. And then prior to operating, it's important to do due diligence so that at least we are safe before we operate. I usually ask patients to, and any good doctor should have blood works done to be sure that your blood counts are okay. Sometimes even scans to fill in the picture. So if you, say, are having tummy surgery, sometimes it's good to know that there's nothing that's in the way for safe surgery.
That you may not have discovered. Okay.
So my question, this was in our DM. So she goes, a friend did a gastric bypass and now has to eat specific foods and take supplements. If she takes long without exercising, she feels pain. She says she wasn't prepared enough for the life after. What are the lifestyle changes one has to endure after weight loss surgery, and how does weight gain impact the changes previously made?
Bypass surgeries are not cosmetic surgeries, and they are surgeries to help someone lose weight. And that could be one of the desired objectives, say if you have surgery in the plastic family, so to speak. So there are different techniques used to have, as part of the weight loss surgeries. You could put a balloon in. And some of these balloons are put when you're seated like this, and you're told to swallow the balloon. And when it's at the right depth in the stomach, it is inflated. So you're full all the time. The other option is to sedate you and put you to sleep a bit. That's even better, I think, in my opinion. And then the balloon is seen as it's inflated in the stomach. So you'll see these trends coming, and it's going to catch up with us here in Uganda. So that's one way. The beauty of the balloon is that it can be taken out at any point.
The balloon is inserted inside your tummy to make you feel full?
Yes.
So that you don't eat?
Yes. You eat less.
You eat less?
Less volume.
The only nutritional
purposes.
Yes.
Okay.
So the beauty of the balloons, and some you don't have to remove them. After 6 months, they can deflate, and you pass it out without knowing that you did pass it. So that's, I think that's a beautiful way of doing things, as opposed to doing, say, the bypass surgery. But where it is done, the bypass surgery sort of bypasses some of the absorptive parts of the intestines. So because of that, the nutrients, some nutrients are not absorbed, so you need to replace them. That's why they advise a particular diet.
Supplements and all.
Yes. So if you don't take those nutrients, you could end up with a deficit. But you take normal portions of food, and it just goes past the areas it could be absorbed. So that's one way of looking at it. The other option is a sleeve gastrectomy, where part of the stomach is taken out, so that you're also reducing capacity of the stomach. So instead of taking a full plate, you find that your portions are small and smaller. Discipline. So the balloon forces you to have discipline. So does the sleeve gastrectomy. The bypass makes it impossible to absorb the food, and you must then supplement. And all this information needs to be availed to the patient or the individual having the surgery before the surgery, so that at least you're not surprised that you feel a certain way.
I'm pretty sure people are advised, but I think as human beings, we pick what we want from conversations.
But I also think it would be prudent for the doctors to always have somebody else to be able to relay those messages, not necessarily from the surgeon. I feel like surgeons are such technical people. First of all, they have the worst bedside manner.
That they do.
Surely, Pumla.
We're different. Surgeons have made. He's a sweetie, but even you, Wama, let me be honest, even him, there's a geekiness about them that they're, first of all, they're mostly introverted. So they don't want to spend so much time talking to you. They want to give you facts quickly, and that's it. So sometimes you might find yourself missing the important points because that information, for him, it's just technical. But I feel like they need like a nurse of sorts whose job is to explain all those things to you and answer all your questions, and this is even during the healing process. Because I find that doctors are not very, they are smart, they have all the information, but passing it on, relaying it, for you to actually understand it, there is a mismatch, a gap.
Okay, so speaking into that. So our consultations, cosmetic consultations take time. We'll probably be there for an hour, asking questions, probably come back again, ask more questions. The time of surgery will answer even more. And all through the healing process, be able to answer more questions.
Yes, true. Because I remember I went and I consulted with Dr. Peter. And one, I think also on our side, we need to do due diligence. Sit down, write your list of questions, do your research, get into that room, because I was there, I think, for 1.5 hours.
What?
Yes, he took me through, it's like a teddy bear, you know. He took me through everything. This is like this. He told me I have a good nose. No, he didn't say good nose, but he's like, you know how they start. Yeah. It's like, well, we could, you know, that nose could, you know. Yeah. But I mean, he took me through everything. I definitely didn't want to have a BBL, but you know all the craterlets in the world? They reside in my bum. You know, first we are those kids who went to school in the 90s, so those injections, yes. Mrs. Manana will remember. But yeah, so I have lots of those. So he explained to me, we can remove fat from here, we can put it on this side, we can do this and this. And then also I was under no pressure to do it immediately. So he gives you time, you know, go think about it. When you're ready, please come through. So I think that for the people out there, take time, ask the right questions, you know, so that, you know, you don't have, because honestly, how can you be saying specific foods? By the time you're going for a gastric bypass, you should kind of know that, right? You know, these things are expected.
The discipline that you could have had before you go for that gastric bypass, they are now going to push you, put a balloon in you to push you to have that discipline. So that discipline, especially with food, because many people are asking in our DMs, oh my goodness, how do you do it? Intermittent fasting, someone is like, no, I can't go without sugar. My dear, that discipline, they will discipline you with a balloon. With the balloon.
I met a lady there, and she was so chatty and so nice and so happy. She was also healing from a different surgery. But I remember Dr. Peter refused to touch her until she had lost a certain amount of weight. And that was for him, I guess, the discipline he's trying to instill. Yes. I'm going to do this for you, but let's see, will you be able to keep that discipline? Then after the regret comes, and I did the surgery, now 2 years back, I'm fat again. I'm back where I'm supposed to be. So I remember when we were having that discussion, I think she waited 2 years. She showed me her pictures. Before, that girl, that lady, we really bonded. She would show me her pictures, and like her initial pictures, like, oh my God, you know, she was huge. But then she started doing boxing and working out, working on her diet, and true to it, 2 years later, she came back and she lost the weight and came back. So that speaks to the discipline of the person. That even before I've touched you, you have a discipline instilled in you, so that after the surgery is done, you can continue. Now, because it's up to you. Surgery can only do so much for so long.
Exactly. People assume it's a quick fix, but...
Yes. I actually think discipline speaks to partly why people want to do surgery, or rather exposes why, because they might be thinking, I don't want to work out, I don't want to change my diet, let me go to Dr. Peter so he can, and then you realize, he's not a magician, and he's going to give you a bomb body, but you also need to put in the work. You need to put in the work.
Maybe my bonus question would be a quick list of things that somebody could do. For me, I've already told you I need my craters to be filled in.
Okay, so head to toe, hair transplant. It's
hair transplant. Banange boys.
It's possible to have a hair transplant to increase the density of your hair on your crown. It's also possible to use PRP, platelet-rich plasma, we call it. To increase and rejuvenate the scalp and augment growth. It's possible to do micronized fat, nano fat under the skin, so as to give you that rejuvenated look again. Yes.
Interesting.
I also do lots of blepharoplasties, that is eyelid surgery, because as we age, we sort of tend to have sagging skin, excess skin. Around the eyes. And then so there are crow's feet, Botox, a dash of Botox can help smoothen the face, those lines where they are. It's also possible to use fillers in fat, again for people who frown a lot, to sort of blunt that effect. I also do eye bag surgeries, so as to take away that that hollowness around the eyes. Fuller cheeks will always give you a youthful look. So feeling of the cheeks, Pumla is so the rosier the cheeks, the younger you look. Now as we age, things tend to sag. It's possible to do a facelift, threads to pull back everything. So do chin lipo because of that, the double chin,
which I have.
Part of the Caucasian population I treat down at the coast have turtlenecks, like turkey necks. So lifts for that, neck lifts.
Past the nose.
Sorry?
Oh yeah, the nose.
Oh, the nose. The nose, they are aesthetic noses. Some communities have wider noses, and people who have had, say, rugby injuries, have been punched in the nose and is partial nose collapse. They may have functional impairments, like, say, a deviated septum. With rhinoplasty, it's possible to fix that, so you have proportion. Deviated septums. The septum is what separates the left and the right side. And it may be causing a blockage in the nose. So that valve, there are two valves, internal valve, external valve. It's possible to sort them out so someone can breathe better. So it's both functional and cosmetic, the rhinoplasty. As we age, the upper lip may become thinner and longer. So it's possible to tuck it back. We see that more in the Caucasian population, but we are also seeing it in African population as we age and stay longer on Earth. So most Africans are endowed with full lips. So if a lip is full, it's more luscious, if I can use the word, and then yes. I cannot comment about that. but yes, I concur. So bat's ears, there are people with ears that look like a famous actor's ears.
Popo. Sorry, ears like jumbo.
So it's possible to pin them back and be able to restore aesthetics. Maybe sticking out like that. It's possible to bring them back in line. I also do lots of breast surgeries. Lots of that. Breast implants.
Lips and reduction.
Yes, the full range. It's also possible to do surgery on men, man boobs. Most men cannot take off a shirt and go swimming at the beach.
Is that so?
Or in a pool, they have to wear a vest. Yes.
Or is that because of weight? Like their weight, they have... Really?
So...
Like even exaggerated do to avoid child.
So if you look at 100 men, about 2 have man boobs.
Interesting.
So, and some are very big. When they are running Baywatch style. but suffice to say that most men need at some point some form of breast surgery. And it could be cancerous if it's just one breast that is enlarged. But I mean, if it's a confidence inhibitor, it would be good to sort it out. Tummy tucks. Men are also coming in for tummy tucks. They're not being left behind.
As they should. Because can I just comment on tummies for men? You know, like I feel like women have a reason for big tummies. When I see a man with a big stomach, I'm like, what's your excuse?
And the thing is that not only do they have no excuse, they don't even try to tuck in.
How can they? They try.
They say
like a tight shirt.
They say
you can sing at the shop like this. There's a couple.
I hope you're not describing me. Yeah, but most men say that they are keeping ladies company. When you're pregnant, is pregnant.
It's a lie. We don't need company, please.
Keep your company.
Yeah. But the ideal man shape is a V shape, wide chest, broad shoulders, the nipples at the sides, and then flat tummy with a six-pack to boot, a narrow waistline. Yeah, and the butt should not be bigger than the ladies, the wives. But suffice to say that they come in, and they also, incidentally, men are also coming in for butt reduction. And some for augmentation, but those augmentation, if they are interested in so for those it's possible to do both, to reduce or increase. But most ladies will come in to reshape the butt. I see lots of ladies with square butts, and they want them curvier, rounder. The ideal butt is A-shaped, narrow waistline, wide at the base. Yeah, and
Filling in of craters.
yes, the hip dips. Hip dips are a big thing.
Hip dips.
The dips on the
They're
side
like
of the
your
hip.
butt dips.
Yeah.
No, I'm talking about, the injections. They leave like little, the.
So you see that hourglass look with the curve from the waist down to the thigh. Some people have an indentation on the side. That is a hip dip.
Emptiness
Yes.
on the side.
Yeah. So part of the surgery is to fill those, and curves will always look good on you.
Yeah.
Just like a bit of muscle will always look good on you. Yeah. So sculpting, body contouring, brings out the curves, and we also sculpt to sort of bring out the muscle. And if you see anyone with a six-pack or something close, or curves, as the light bounces off our bodies, the curvier we are, the more aesthetic, the more beautiful. So that is the ideal shape that everyone is on the lookout for.
Aspiring to.
Okay, I think let's go back to our viewers' comments. I got this from YouTube. So I have a colleague who passed away due to complications of anesthesia and hematoma, whatever that is. Hematoma. What are the potential risks or complications of surgery?
So a hematoma is a blood collection somewhere. And usually it is important to say where it accumulated. A small percentage of people who have tummy tucks may get a bit of blood collection under the skin, but that's okay. It happens, and it can be drained without issues because it is not communicating with anything. So that's one possible complication. Of course, bleeding. If you've had surgery, it's a risk that you undertake. Sorry, that you could face. But we do due diligence. We look at the clotting factors in your system. The platelets are a quick way to know whether you have a bleeding disorder or otherwise. The other bit is that the history. So when we spend that several minutes talking before surgery, it is to establish that there's no one in your family who is, say, a hemophiliac. If there's anyone in the family who has a bleeding disorder, chances are that it would be resident with you,
within you,
God forbid, and then would need to check. So, and you'd know, if you've grown up to an adult age, at some point you've had a cut, did it bleed excessively? So that quickly comes out when one is, and even so, if you know that one is a hemophiliac, there are ways of addressing, say, bleeding disorders. You can then respond. So doing due diligence prior to surgery is pertinent. It's very important. So risks there, but like I said, surgery is like a flight. You take a flight, you sit onto this plane, you trust that you will arrive there. And besides, how many aeroplanes have accidents?
Not many.
So
Still you sit in
borders and in cars that have accidents
every single day. Yes.
Yeah. So surgery, we do due diligence prior to surgery. Intra-op, we also monitor closely. Okay. Yeah, and so the team is chosen to make sure that you're safe. You make sure that your surgeon is a good surgeon.
Yeah.
The anesthesiologist chosen, anesthetist chosen, is on speed, is to speed with what's going on, and is alert all through. And the whole team keeps the other accountable, and there are checks all through the surgery to make sure everything goes well. And then post-operatively, we also ensure that you don't get issues. We'll encourage you to move when you're fully awake. That prevents clots. And then we'll also encourage you to maintain a particular position so that, say, your suture line is protected. Yeah. Then the handling of, say, the wound. And so there's a lot of detail to make sure that you're safe. You don't get an infection and that you heal adequately.
You know, one of the things that that calmed me when I was having my surgery, when I walked in, there was the room is like nice and bright and white like this with lights, and there's different people walking around in the theater, and there was gospel music playing. So he set on gospel music, and that nice calming gospel music, and they were singing along. So it seemed like these people had worked together for a while, and they were singing along. And then when and it was nice, like I was like, oh, this feels really nice. It felt like heavenly, you know. So then they did all the work done, and then they put me on the table, and then they made a circle and asked me if they could pray over me. Oh, nice. It was so blessed. I was like, hey, and for me, because he had kept saying, by the way, he's so Christian, and we had it in the comments, people kept trying to delink religion from plastic surgery, as if, no, but you're a work of God, why are you working on it? But I felt so much comfort in that science and religion can come together and work together, because they just made a circle, and they asked me if I would like it, and they just prayed over me, you guys. It, like, even putting me to sleep is not what made me feel peaceful. It was just that entering that whole heavenly thing over, you know, taking in the effort to put me at peace and make me calm. All the anxiety just disappeared, melted away immediately.
So I came to a realization that everything we do is really permitted by God. If you believe that or don't, at the end of the day, it's a choice you make. It's a personal choice to pray for patients, and I thank God that I get that opportunity. So I think there's only one person who has said, actually no one who has said no to prayer prior to surgery. I'm yet to come across one. But when you keep talking about God, some people take offense. So, but prior to surgery, I'm yet to meet anyone who says no. So Christianity and plastic surgery. The first plastic surgeon was actually God. And the first anesthesiologist was God. He put Adam to sleep. They took out a rib. And the plastic surgeon in the Bible
created a woman.
So he created a woman, and he said she was beautiful. Ours is a work of beauty, and every day I step out to accentuate the beauty. But talking about plastic surgery and God, it's impossible to separate the two. Because here goes. We use rib to reshape people's noses. We use the rib to create new ears. We use the rib cartilage to, you can ground it to a paste to form a scaffold for many things. Ribs can be taken with blood vessels to replace bone elsewhere. You could take a fibula in the body and use it to form, say, put new bones in the arm if they are missing. So we are just emulating. We're just emulating. We're just trying. I mean, we are made in His image. We are trying to be like God. We are not trying to be Him. There's a big difference, but like Him.
He's doing the work of God.
He's doing the work.
Yeah. I mean, I feel like we've already addressed the healing process. But I think one of the other things that really came through in the comments was the issue of cost.
Oh.
Yeah. I don't know if there are any shortcuts to it. Do you have discounts?
Yes, we do.
Discounted
we
surgery.
We even do offers sometimes.
Oh, okay. Please.
Yeah, and I think we'll not announce it on set, but we'll see what to do.
Oh, okay.
Our viewers are going to ask when the offer comes. But the offer could start as here.
It started already.
Yes.
We did.
Yes. No, you got a discount and then an additional offer.
And I like the fact that you're recording this as you as you're handling. But yes, of course, we do. So talking about cost is just like anything. I'm yet to walk into a supermarket and pick. Okay, I was at 5P's Fashions yesterday and I had to pay for this suit. So just like anything good in life, sometimes you pay a bit more to enjoy the auspices that go with a good service. In terms of the theater, because that's a cost. In terms of the anesthesiologist, in terms of the surgeon, the materials that we use, they all add up. So I'm still dodging the amount. But
we're waiting.
But
we could look at two. What's the common ones? Usually people want to do the.
I know. I have had patients who've had surgeries done elsewhere and then they come to us. So like a tummy tuck in, say, New York, it's probably going to set you back by 20,000, between 15 to 20,000 dollars. So now tummy tucks are of different types. Now I'm trying to qualify. So that's in the US. That's in the US. We're not going to charge you that. And then there are different types of tummy tucks. You may go in and have liposuction with your tummy tuck on the sides. You could go in and you have 360 lipo with your tummy tuck. And then when I perform tummy tucks, I prefer to, for example, do the liposuction with the tummy tuck, so that at least the
I think even in the previous show, the lady mentioned if you squeeze the surgeon too much, then you'll get maybe a deputy to do, the final. But just get in, get your quotation, and then decide. And I also believe that for something like cosmetic surgery, it's not something that someone walks into and like, okay, let's have this done. It's well thought of. So people who seriously want to do this will get the number. They'll come in for the consultation. Because if we give them numbers, and someone's like, but hey, on the show you said.
We are a price-sensitive community. As Ugandans, we are. But I do agree. I think those who are serious about surgery, you go the same way you did, the same way you went in and did a consultation. But I also remember in the previous show, you guys mentioned that your bills were different. You and Manuela's bills were different. I think because of difference in body and all these other, sensitivities.
And what they wanted was different. Because
what we wanted was different. What we needed was different. And I remember when we came out and I started comparing, that's when he told me that, because I had like a bit more muscle and less fat, like I wasn't built, we were built different. So I remember told me that actually there's a size above which for him is a perfect candidate for surgery. And for me, he said like some of the things, like I was still on the smaller side, but you know what, we will work with that. But I remember.
So am I perfect for surgery? Maybe so, of course. Everyone is
before the show started.
So
you're doing so well.
No. Because so I mentioned that I wanted to reduce my tummy. Not because, so my tummy, I said this on the show, that my tummy and my size for me don't match. I don't know if it's an internal, no, it's not an internal thing, because when I see myself in the mirror, I'm like, I wish my stomach was just
a little.
But I am still in the childbearing business. So
that conversation.
When you look at me, what do you think I am eligible for? Do a mini consultation.
No, I have the benefit of having just watched the show.
Yeah.
You mentioned breast.
Yeah, to lift.
So
to have a big
yeah,
breast.
it's possible to do that for you.
Okay.
What I know is that our clothes hide a lot. Eh?
A lot.
A lot.
Yes,
yeah.
a lot.
Yeah. So you'd be surprised that when someone dresses up, they are hiding the fact that they maybe need, say, leg augmentation. They are hiding the fact that, say, they, like, when I look at someone, I'm like, okay, so I can chisel their quads to look, defined, maybe there is fat around the knee.
Yeah.
If you are from the community somewhere near the cattle bearing, you may find those ones you may find, so that shape is achievable, say, using liposuction.
Okay.
So, and you may find, say, that you've lost weight and the thigh is sagging. A thigh lift could do.
Would do.
Yeah.
Okay.
Or you find, say,
thigh lift?
Yes. Yes. Yeah, so it varies.
Yeah.
So.
Okay.
Yeah.
Okay. So people, go and do your consultations if you're really serious about this surgery thing.
Yeah. And you asked about tummies. There are like different types of tummy tucks. There is mini tucks, whereby you take out the portion of, you look at someone, they have like a small funny
like a pouch. Yeah.
Like a pouch.
Yeah.
So it's possible to do liposuction and remove that. So it becomes a mini tuck and lipo to give you the contours that you need.
Okay.
Yeah.
Okay.
Yeah.
Let me go and rob a bank.
Let me take it a step further. You want to go swimming and you want to wear a bikini.
The two-piece, yes.
And for some reason there is nowhere it is hanging. It's possible to create curves for you and the diamond with dimples at the back so that the curves as they show.
What did you say?
I think we need to go.
Yes. And
what can't you do?
Yeah, so it's
an
possible to contour things right, sculpt someone to look really good. It's possible. Yeah.
Okay.
I mean, this has been a very insightful show, but I'll ask. Okay, not ask, but I think it's also important, like the way you say, women need to have that diamond shape. Some of us don't have it. Yeah. So we can still be in our shape, right? Yeah.
Yeah, it's possible. Look, aesthetics are. I talk about lights and shadows. It's what the eye sees and what is there and what's not there. For example, if you have no fat on your waist, then if you have just slightly narrower waist, then your hips look wider. But if the hips and the waist are the same, then it's different. Beauty is in the eye of
the beholder.
Not just the beholder, but the body owner.
Yes.
Yes. So true.
Yes. So you can have a certain shape or a certain body, and you're comfortable with the way you are. That is important. So one of the questions I ask my patients is, who are you doing this for?
Yes.
Because if you're doing it for someone else, they may never be happy.
Slippery slope.
There is a gentleman who, I don't know whether you want to record this. So I'll just say this. I don't know how you're going to use it, but I'll just say it. There's a gentleman whose girlfriend wanted things elongated, wider. And we did it. She went back and said, but where I have been, things were different proportions. So the guy was not very happy. Had another surgery, and she still left him. So the question then is, people need to be comfortable with their bodies. Yeah. But if a small tummy is getting in the way of the job that you want or the happy life that you want to enjoy, then you can do something about it. Yeah.
So there you've had it. The ideal body is the one that God gave you. What he does is simply accentuate, right? So to all the women, to all the parents out there, you shouldn't feel alienated. We will try our level best to answer the questions. We are dressed by the one and only fashion episode. The cutie from Shoe Puzzle sorted our heels out. Mama Zara's hair was done by Zuri Beauty Bar. We are at the Golden Tulip that is located in the heart of Kampala. Until next time, with love from Bump Club.